So you can see how far forward that lower neck angle is and how it comes up. And then now today, this is it without the weights on.
Oh, wow.
Maybe if, like, from your perspective, could you share a little bit about my case?
Your lower neck curve was way too far forward. This happens so often that people, they have their lower neck curve. It's really far forward. They'll get an x-ray and it's like, oh, you've got a lordosis. Yeah, you do. But then if you really did ultrasound of the vessels in front of the neck, you'd see that in the lower neck, they're going to be either like the carotid is pushing way too hard or the jugular is completely closed. I've had probably 50 people that I've put a reverse weight on and they've gotten better blood flow, better drainage out of their head, more clear mentally, better mobility with their neck.
Yeah, I remember when you did the ultrasound, according to you guys, it was one of the worst, like, flow you've seen with the jugular, and then you put the neck weight on and it, like, totally opened up and I was like, "Whoa, that's crazy."
Since then we've learned more. So before I would only, when I put that reverse weight on, I would only test the blood flow above it. Now I've been, exposed to more and learned that I actually check the blood flow above it and below to make sure we're not compressing anything. We check how not only that the blood flow is improving above and below the weight we're putting on, the curvature looks better, and that the individual feels better from using it. Doing dry needling in the way that I'm learning, but I've been changing it a little to focus exactly on how to stimulate the tendons to get stronger. And we're seeing people getting a lot of amelioration of symptoms that they've had for sometimes 5 years, 10 years.
Wow.
With doing dry needling to tendons, because tendons are collagen, just like ligaments. I mean, they're just barely different in, how they're composed. And if you get the tendons to be really strong, I mean, it helps a ton with hypermobility and, EDS type presentations.
What would you recommend, like, to do at home if you don't have the means to come see you or to come see someone to have prolotherapy treatments? Are there things that they can do at home to help improve the neck curve?
The main thing that I see, Rachel, with people with any kind of upper neck injuries and, is first of all, you have to be able to get out of the hinge position. So I say, like, when you move around, you have to keep your neck up into this position. And like, if you get up, you have to get up while you're still here instead of like, getting up like this. Like so many people get up like this and then, or they're told by their doctors to just pull their arms back and look up, and it like kinks them more into this position. And so that actually is exacerbating because you're contracting, closing off like the suboccipital muscles, which the suboccipital muscles are supposed to keep the head from falling backward on C1. So when they're not working is when you're here and the head falls backward on C1. And then also using specific weighting. We designed 2 new products with the Halo Weight Company. I went out in December and we kind of, made progress with, I think I was the first one to put the reverse weight on, which we used with you, Rachel. And you said that part of it was helpful for you to feel. We saw your lower neck curve went from being super far forward to being up taller. So that helped displace the weight of your head on your body better.
Is there anything that you would like to share with people who might be in a really difficult place right now, dealing with cervical instability? What advice or encouragement would you have for somebody in that situation?
There was this interesting thing I saw online earlier today that was actually inspiring. Sometimes we see things online and we're like, oh, really? But what the gentleman said was, okay, if I gave you $1 million today, would you be happy? Like, would pretty much, for a few days, like you'd be pretty happy, right? He's like, okay. Now, and if I give you $10 million, you'd be pretty happy too. He goes, what if I gave you that $10 million, but you couldn't wake up tomorrow? Like tomorrow, that was it. And then they said, no way, I wouldn't take it. And so then he said, so waking up tomorrow, you're telling me, is more important than $10 million. And they were all like, wow, now that you said it that way, it's like, so every day you should be feeling, like this is a good day. And it can be really hard to do that when you know where you were at one point or what is expected of you from people around you, or what you feel like societal norms are for how you should be performing on a day-to-day. But like just being alive, there still is a gift in that. And please focus on what can I do, even if it's just 30 seconds today. I tried to fire my suboccipital muscles. I was conscious that when I went to the bathroom that I didn't hinge here, and I started to hold this position that Dr. Hutcheson showed me on this video. Or, I did a little tiny bit of research, and I focused on the people that are healing, like Rachael alluded to earlier, and only spend 10% effort or energy on the people that are still sick, because I still want to be connected to that, but I want to focus more on where I'm going. So, just never give up, and, just keep trying to take the leap forward. And, with enough consistency, you'll get there.